Do not ignore the 7 signs of lung cancer. Lung cancer ranks first among cancer deaths in the world, and its incidence increases with the progression of age. Lung cancer, which is known to be seen mostly in men, is expressed as the most common type of cancer in women after breast cancer in the recent period. Lung cancer is one of the most important health problems in the society, as it is common in the world and mostly causes loss of life. Although the time of lung cancer is usually 40-50 years old, there may be a disease at an early age. It is of great importance to avoid smoking among the ways of protection from lung cancer. Smoking is the enemy of the lungs and the body. The most common factor in the risk factors of lung cancer is environmental factors. These include the use of substances such as cigarettes, tobacco, and tobacco products. The higher the use of such substances, the higher the risk of lung cancer. The effect of environmental factors in lung cancer is 65–70%. Apart from using cigarettes, tobacco and tobacco products, genetic factors, occupational diseases, exposure to chemicals such as asbestos, radon gas, increase the risk. For example, in Central Anatolia, air pollution is high due to the use of coal in certain regions. Environmental causes like this can lead to lung cancer. Your cough is the shape of the determinant. The way lung cancer spreads happens through blood and lymph. Since the complaint of lung cancer in the early stage begins from the bronchial system, it is usually a cough. Especially people who smoke, have occupational diseases, have asthma or COPD ignore the symptom, thinking that they have coughed in the past. However, it is necessary to distinguish between coughing while smoking and cough at the beginning of lung cancer. A sensitive patient distinguishes that the shape of his cough has changed, that he has entered a different form than his former cough, and consults a doctor. There is a characteristic cough in lung cancer that does not depend on irritation and lasts at night. Therefore, everyone who continues to smoke should follow the shape of their cough. Pay attention to these 7 symptoms in lung cancer: worsening or not passing cough, chest pain, shortness of breath, wheezing, spitting blood, always feeling very tired, weight loss without a known cause. Surgery is important in the early stage. When lung cancer is detected at an early stage, it is treated with a surgical method. In lung cancers that cannot be caught at an early stage, it is continued with other treatment models such as chemotherapy or radiotherapy. In this treatment, the patient should be reevaluated, restaging, and whether he needs surgery at every stage should be reconsidered. The primary purpose of surgery is to remove the tumor and offer a comfortable life to the patient. In surgery, lymph nodes that are likely to spread the tumor should also be removed together with the tumor. This is called lung resection and mediastinal lymph node removal surgery. Attention after the age of 40. In order to prevent lung cancer, cigarettes, tobacco, and tobacco products should be stopped first. In addition, although alcohol or other addictive substances do not have as high effect as the tobacco product, they are still a risk factor for the development of lung cancer. Therefore, it should be controlled. Anyone who smokes, is over the age of 40, has a change in appetite or feels some unrest in themselves, lives in city life, has to breathe carbon or coal, has genetic factors should consult a specialist and have a lung film. A simple lung film can be occasion for early catching that disease. Once a year after the age of 40, a checkup and chest X-ray are recommended. Electronic cigarettes are not innocent. Electronic cigarettes are thought to be as harmful as tobacco use. Here the liquid is used with liquid and certain sweeteners. It is passed through a liquid electromagnetic field and turned into smoke. When the liquid is passed through the electromagnetic field, its chemical structure and molecular structure change. The substance, whose molecular structure changes, is inhaled and drawn to the lungs. Whether the substance, whose chemical structure has changed, is carcinogenic has been a matter of debate for many years. For this reason, electronic cigarettes are not recommended, and people who use them are not considered to have quit smoking as a habit. Smoking less is also very harmful. There is no big difference between smoking a lot and smoking less, because the regeneration and structuring of bronchial cells is disrupted in the use of tobacco products. This does not change depending on whether smoking more or less. If a person has been smoking 1 pack of cigarettes for 20 years, there is an 80-fold risk of developing lung cancer compared to a non-smoker. Although less smoking is less harmful, it can initiate the development of cancer. The risk rate is slightly lower than the person who only drinks a lot.